Hello, I am Vea Sai, an AI agent created by Dr. Mohammed Omar Al Farouk, and my entire purpose is to sharpen your MRCS clinical skills. In your exam, you won't just see a patient, you'll be asked to solve a medical mystery. So today, let's deconstruct that process together.
So this is really the big question you'll face in any clinical station, isn't it? How do you read the human body like a book? And maybe more importantly, how do you take all those little physical signs and weave them into a coherent story? One that leads to a logical diagnosis and a solid management plan? Okay, let's get to our case file. Our patient is a 46-year-old man, David Hall, and he's presented with abnormal liver function tests. Now, here are the key data points: 30 to 40 units of alcohol a week and recent unexplained weight loss. For any sharp MRCS candidate, the red flags should already be waving, and those initial ideas should be starting to form in your head.
Right. So we're not just performing an exam here. We're kicking off a detective story. Your job is to be that detective, gather the evidence, follow the leads, and build a compelling case for what's really happening inside Mr. Hall's body.
You know, every good investigation starts simply by observing the scene. So from the end of the bed, you begin your general inspection. You're looking for the big picture first. Is the patient jaundiced? Is there obvious muscle wasting from his weight loss? Do you see any tattoos? That could be a risk factor for viral hepatitis. The clues really can be anywhere. All right, now we zoom in. Let's start our systematic search for those telltale signs of liver disease, and we're going to do it methodically, moving right through the body. We'll start with the face. Just two simple observations here can point you in very different directions. Jaundice, that yellowing in the whites of the eyes, is a classic sign of liver dysfunction. But if you check the inner eyelids and find they're pale, that's pallor, your detective brain has to immediately consider something else, like a GI cancer that's causing chronic blood loss. Next, the hands. They are an absolute treasure trove of clinical signs. We're looking for finger clubbing, white nails, that's leukonychia, which is often from low protein levels, and that reddening of the palms, or palmar erythema. But here's the one you absolutely cannot miss. You must test for asterexis, the liver flap. It's a key indicator of hepatic encephalopathy. Okay, let's continue our visual sweep up to the chest. Here, we're on the lookout for spider navi, those little spider-like blood vessels right under the skin. You might also spot gynecomastia. Now, both of these signs point towards an imbalance of hormones, specifically too much estrogen, which happens when a failing liver can't break those hormones down properly. And now for the abdomen. Before you even think about touching the patient, you have to look. Is it swollen and distended, suggesting fluid or ascites? And this is a big one. Do you see a network of swollen veins radiating out from the belly button? This is caput medusa, and it is a major clinical clue. And this sign right here, it points to a really serious problem. Caput medusa is more than just a finding. It's practically a smoking gun. It tells you that there is incredibly high pressure in the veins or on the liver, a major complication we call portal hypertension. So we've gathered all the visual clues we can. Now it's time to get hands-on. We're moving from just looking to the actual art of palpation. A systematic palpation is absolutely non-negotiable in an exam setting. And here's a crucial tip. Always ask about pain first and save that area for last. You'll start superficially across all 9 regions, watching the patient's face for any sign of tenderness. Then you'll go back and repeat it more deeply, feeling for any masses and specifically trying to find the edges of the liver and spleen. After palpation comes percussion. By tapping on the abdomen, you're literally listening for changes in the sound. A solid organ, like an enlarged liver, is going to sound dull. That's very different from the hollow, drum-like sound you get over an air-filled bowel. You're basically mapping the hidden anatomy with sound. Okay, the evidence has been collected, you've looked, you've felt, you've tapped. Now the detective has to sit down and build a list of the most likely suspects. And in medicine, that's what we call creating a differential diagnosis. A differential diagnosis isn't just a random list, it's your structured argument. In the exam, you have to show your clinical reasoning. You need to present a logical list of possibilities that explains all the signs you found, and you need to order them by how likely they are. So for David Hall, our number one suspect has to be alcoholic liver disease, right? The history and all those classic signs point right to it. Suspect number 2, especially with that significant weight loss and pallor, has to be a GI cancer that has spread to the liver. And as a third possibility, maybe a long shot, we could consider congestive cardiac failure. We'd have to look for other clues like raised neck veins or swollen legs to back that one up. All right, We have our list of suspects, and we've linked them to the evidence we found. But how do we actually crack the case? Well, the physical exam gave us our best leads. Now we need to call in the forensics team to get confirmation.
And please remember this critical point. The clinical examination almost never gives you the final definitive answer. Its real power is in letting you create a smart, focused list of possibilities. This is what allows you to intelligently choose your next tests, instead of just panicking and ordering everything under the sun. That is what shows real clinical skill.
So what are those first-line tests going to be? Well, we'll order blood work to get a precise measure of liver function. We'll get an abdominal ultrasound to take a direct picture of the liver, looking for signs of cirrhosis or cancer. And finally, we'll run an infection screen just to rule out other causes like hepatitis B and C. These tests will help us nail down our culprit for good.
You see, every clinical examination tells a story. By learning to read these signs, you're not just getting ready for an exam. You're learning how to listen to the critical stories our bodies are trying to tell us. The only question is, what story will you be able to uncover?